First, atrial fibrillation is associated with a 5-fold increased risk of stroke. So these don't tend to be these small strokes that you kind of go about your business. They tend to be the bigger types of strokes because the mechanism is an embolism traveling from the heart to the brain. Other problems that are associated with atrial fibrillation that have been fairly well worked out epidemiologically is there is an increased risk of heart failure, an increased risk of dementia, and interestingly enough, an increased risk of all-cause mortality. And that's adjusting for all of the risk factors for those conditions that are associated both with the outcome and with atrial fibrillation. Another reason why it's an important problem is as we've gotten better at treating cardiovascular disease, people are living longer, and they're living longer with chronic cardiac conditions, and so they have more time to actually develop secondary conditions or other conditions such as atrial fibrillation. So it's been observed in multiple data sets looking at the same question multiple ways that the prevalence of atrial fibrillation is increasing on the order of 2.5 to 3 million today. By the year 2050, it's estimated that there will be on the order of 6 to 12 million Americans with atrial fibrillation. So it's a very large problem. Part of that's the aging of the population, but over and above the aging of the population, it appears that the prevalence, or how common the condition is, has been increasing. So the goal of the American Heart Association is ambitious, and part of it is to decrease death and disability from stroke and cardiovascular disease by 20%. But the American Heart Association has shifted its philosophy, in part responsive to patients, to healthcare advocates, and the general public, to realize that it's not enough to be free from cardiovascular disease and its ravages. We're really emphasizing healthy living and living longer in optimal or good states of health.